Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss an incredible piece of evidence published by the COVID inquiry which should lift the lid on the callous way in which the Tories abandoned tens of thousands of our most vulnerable citizens in care homes in 2020. Should be on the front page of every newspaper. It's not. It's barely even been commented on. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel. So Matt Hancock at the COVID inquiry again today, insisting that he was not a liar and that it was Dominic Cummings scuppering COVID responses with his climate of fear. What has been notable from the last few weeks of evidence from senior decision makers is just how quick the political decision makers are to cover their own arses and blame everyone else, whereas the scientific figures have acknowledged their own errors in hindsight. A fundamental difference in character between scientists, who must always be critical of their own work if their work is to do anything, and politicians and political advisors who only have to convince people that their work is valuable for it to be judged valuable. In fact, it's quite remarkable. If you take someone's evidence, pick the four main ones who are really trying to cover their arses: Matt Hancock, Boris Johnson, Rishi Sunak, Dominic Cummings. There are a few others as well. Some of them have more evidence to give, but all of them have submitted some so far. All of them have sought to make out that they did their very best, and all of them have sought to make out that those around them were messing up very badly indeed. So they're no longer arguing that they did their absolute best and that actually things were done as well as could be expected. They all now acknowledge that actually it was a complete mess, but it wasn't their fault. So if we were to believe any single one of them, we would have to believe that that person alone was getting everything right as far as they could, and literally everybody else was incompetent and potentially not even trying. It defies all reason to believe any of them, particularly Matt Hancock. Turns out he's saying today he didn't even read the minutes from SAGE, which is the Scientific Advisory Group for Emergencies. Global pandemic, sweeping everywhere, around the world, deadly as you like. Serious emergency, undoubtedly. Serious emergency. The Health Secretary, is he going to read what a group of scientists specifically formed by the government to advise them on emergencies, should he read what they've got to say about it? No, can't be bothered. I mean, and the decisions which led to the tens of thousands of deaths in care homes, that was a political decision, not a scientific one. The decision to cut back NHS provision from being the best in the world in 2010 to where it was in 2019, that was a political decision, a conscious one. In 2020, the government, including Boris Johnson and Matt Hancock, said that they threw a protective ring around care homes. Even when Boris Johnson was trying to suggest we're going to let the virus sweep through the population, he would justify it as, oh, we only mean the healthy people. You know, the very vulnerable people in care homes and so on. We're going to put a protective ring around them. We're going to shield them, let it run through the rest of the population. It'll burn itself out like a wildfire, and then that'll be that. Scientific gobbledygook, of course. You know, according to the Office for National Statistics, there were over 45,000 deaths in care homes where COVID was cited as being involved between March 2020 and late January 2021. 45,000 COVID deaths in care homes within the space of less than a year. Some protective ring. And we knew at the time exactly why this was. And it was not widely reported. It was because hospital patients were moved from hospitals to care homes without being tested for COVID. The government guidance at the time specified in black and white, no negative COVID test was required for these people. And this was atrocious, a couple of reasons. First, it meant that infectious people were being sent to care homes, a poorly ventilated indoor environment with lots of the most vulnerable people in close confines. It was a death sentence for tens of thousands of those the government claimed to be shielding. Second reason this is so appalling is because there was no test. That made the situation worse. Like, it's bad enough sending people who are going to be COVID positive into care homes. That was quite bad. But if you don't even know who they are, care homes did not know which returning residents had COVID and which ones did not. Now, in theory, had they known, it may have been possible to isolate them from other residents. I suspect not in reality in many cases, there wouldn't have been the facility, but there may have been some mitigation of risk possible. But because there was no test, care home staff had no idea who was and who was not infected with COVID. And the reason for this was twofold. First, the government did not want to admit to the public that it had run the NHS down. Hospitals being overwhelmed would have been very bad politically, so they needed to discharge patients as soon as they no longer needed that hospital care, so there would always be beds available for emergency cases. But doing so into care homes meant that many more would need that hospital care down the line and even die as a result of the infection spreading, amongst a group of people who were at very high risk of becoming very ill or dying. Second, the government could not just test them and then tell care homes to isolate those who were positive, because many care homes wouldn't have had the facility to do that, and of course would have been even more resistant to taking them in. The public would also have seen the government discharging COVID positive people into care homes, something they denied, because there would be a record of it. So the government kept quiet about it, making the situation much worse. Now, we knew all of this in 2020. We knew what the government guidance was because it was published. We knew that not testing would mean COVID would spread in care homes. We knew that 45,000 died in care homes from COVID in this period of time. We knew all this at the time. But senior government ministers kept insisting that they tried to shield care home residents. Oh, it got into the care homes. Oh no, we tried so hard to stop it. And now we see an email exchange in the COVID inquiry evidence. Now, these are emails between senior officials, really. In one, the question is being asked about the policy of knowingly discharging COVID positive people into care homes. It's pointed out that 2/3 of care home population are over 85 years old and as such incredibly vulnerable. There is a question about strict infection control when this happens. The response back from Jenny Harris, head of the UK Health Security Agency, I can imagine nothing more opposed to our health security than this, explicitly acknowledged that the policy is to put COVID positive people into care homes. Not to risk it, she recognises that yes, this is going to mean COVID positive people end up in care homes. There is absolutely no mention in the email about the strict infection control, and that is because it did not exist and could not exist. As I've already said, how can you have infection control in care homes? How can you have an infection control protocol if you do not even know which people are infected and which are not? And now we're being treated to the political decision makers trying to cover their own arses after what is something I can only liken to corporate manslaughter on a truly horrendous scale. Except it's not corporate manslaughter. I don't even know if these senior ministers are criminally responsible for these deaths. But it is possible they don't know either. Matt Hancock, earlier on in the year, in the spring, said that he wanted immunity from prosecution before giving evidence to the inquiry. He did not get it, but the fact he's asked shows that he thinks he might be in serious legal jeopardy. At the COVID inquiry today, Matt Hancock again denied that he'd lied about COVID. He was shown a document where Hancock assured people at the time that contact tracing and testing were being ramped up, but the reality is that they had stopped altogether at this point. This was the point, I think, at which Boris Johnson wanted the nation to become infected with his pseudo-scientific herd immunity bollocks. Speaking of Johnson, I wonder if he shares Hancock's fears of legal consequences. He's giving evidence next week, under oath, of course. That'll be another unedifying spectacle of a politician having no regard for the lives they destroyed and seeking to blame everyone else for the mess. But my major contempt remains for our mainstream media. What is coming out of the COVID inquiry has been largely proof of what we already knew beyond reasonable doubt in 2020 and 2021. It should have been reported on then. But now we're getting absolute proof. It should certainly be reported on now, prominently, but it isn't, because our media is even more broken than our politics. Indeed, our politics is broken because our media acts against the public interest. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.